Most kids look forward to the fun of the summer, but for 1 in 6 children, events such as bright sunlight, flowery smells, and the 4th of July fireworks can cause anxiety and stress. And Dr. Robert Reynolds, clinical psychologist from Connecticut Educational Services, is joining us more. We're talking about sensory processing disorder. Good to see you, doctor.
Good to see you, Logan.
So tell me about what this is.
Well, we all have 5 senses. We have vision, hearing, touch, taste, and smell. And with many people, 1 out of 6, those sensory processes are sometimes difficult and very, very sensitive. In fact, too sensitive. So a child in particular will do a lot of things to avoid interacting or engaging in environments that are too bright, too loud, even the clothing textures are sometimes problematic. Many times with the younger kids, they insist on having the tags cut off of their clothing because it bothers them.
Right.
So all of their senses are just too heightened.
What are some of the signs that your child might have this problem?
Well, there are a number of them. One is withdrawal, because they're withdrawing from situations that are overloading to them. Sometimes they are very cranky and anxious because they're always on edge, being too stimulated. Sometimes that manifests itself behaviorally. They can sometimes have behavioral meltdowns to try to get the world to stop because they're overloaded. So it can be a number of different manifestations, but all too often I see children with SPD, sensory processing disorders, misdiagnosed as ADHD or some kind of social deficit or sometimes highly anxious, when in fact they're just trying to manage an overwhelming environment.
Yeah, what do you do if your kid has this? What's the treatment?
Well, there are a number of ways of going about this. The most prominent approach is something called a sensory diet. It means you're actually putting a child on a regimen, let's say, so that they're not overwhelmed. But you have to recognize the problem in the first place in order to put them on a sensory diet. So you make sure that they are in environments that they can manage, that aren't going to overwhelm them. So that's one of the keys. But we have other ways of dealing with it too, because we believe that their brains are just a little too sensitive. And we have ways now of calming that sensitivity down. Medications can sometimes be helpful, but we also use some computer training to help them calm down as well. So there's a number of different interventions, but you have to know that this is the problem, and too often we don't know.
Dr. Robert Reynolds, thanks so much for coming in.
Thank you, Logan.
All right, we're going to take a quick break. Back in a moment.